Hello, and welcome to Actuary Voices, the podcast from the American Academy of Actuaries. I'm your host, David Nolan, and today I'm talking with Becky Sheppard, co-chairperson of the Health Equity Committee. Becky, welcome to Actuary Voices.
Well, thank you so much for having me here today. I'm really excited for this opportunity.
Do you mind starting by telling us a little bit about yourself and why you became an actuary?
Sure. So let's see why I became an actuary. My second year of college, I had no idea what I wanted to do. My dad suggested, hey, why don't you become an actuary? You're good at math. And I thought, am I? But that's another thing to talk about. So I said, okay, let me look into this. First time I had heard of an actuary, probably like most people, it doesn't come up a lot in your day-to-day life. So I did a little research and I saw terms like manager of risk and, these different things. And, second year in college, it all kind of sounded very high level, and I didn't really understand what an actuary did by looking up what an actuary is. So I asked my dad more about it. He had actually been a life insurance salesman back in the day when you went door to door and sold life insurance policies. So he said, oh, well, actuaries, they calculate when you're going to die, and they decide how much your premium should be. And I'm like, well, that sounds really cool and all-knowing. We can calculate when someone's going to die. Later, I learned you can calculate when a person is going to die, but not when a specific person is going to die. So not as exciting. But I also learned that actuaries have to take a lot of exams. And that was music to my ears. To be honest, I really like the idea of something very concrete. You do these steps. When you complete them, you're an actuary. It's not a subjective sort of like, are you good enough? My dad had been a piano player, so a very subjective field where, you might get a gig or not get a gig if someone likes your style or they don't like your style. An actuary, if you pass those tests, you're going to get there. So I was really excited about that. And that was enough to convince me. So I actually transferred from the college I was in. I went to the University of Connecticut. They had an actuarial science program. So I enrolled in that, where I started taking a few of those actuarial exams that I was so excited about and failed miserably all through college on those exams. And I think looking back, it's quite a lot to take all of your college courses plus actuarial exams and all of these things. But it didn't deter me. I still was committed to this path, and I was fortunate to get a position out of college. I went into an actuarial student program and had the chance to take exams without 6 other courses and found it a lot more doable. So that's sort of what put me on the path of becoming an actuary.
Sounds good. It's interesting because I think guests on Actuary Voices are evenly distributed between those who love the concept of exams and those who found them very, very daunting. And neither group really believes the other group exists, but I have seen them all. After you recovered from the presumption that you might be able to tell somebody when they were about to die, which kind of sounds godlike, tell me a little bit about the path you took towards becoming an actuary and what led you to that particular practice area.
Yeah, so that's a really good question. So I actually do not even calculate when anyone's going to die. I became a health actuary, much more interested in people not dying. We actually really want them to be well and to live. And so when I was in college, I ended up getting a position at a large national health insurance company. And so that sort of was the reason why. I mean, I didn't really make a conscious choice that I'm going to go into health versus life, and I could have still pursued it there. I guess I did decide I'm not going to do P&C. I'd much more rather talk about people and things like that. In my first year of working, they had what they called like an actuarial student panel. They gave students a chance to present, basically. And in this presentation, my group decided we were going to talk about healthcare rationing. And I just thought this was fascinating. I mean, these were questions like, should we give, vaccines to 1,000 children? Yes, we should definitely do that. That sounds great. Or should we use that money to give one child a life-saving medicine that they need now? It's like, well, yes, we should also do that. How do you make those decisions? How do you think about these things? And not that actuaries need to make those decisions, but I just think being able to lay it out and to think about, okay, what do I need to think about? So there's There's some medicine that prevents illness. There's some medicine that treats illness. There's some medicines that are very effective, or surgeries or procedures that are very effective, and some that are more experimental or unknown. And how do you measure the need, and what's the value of it, and the value from whose perspective? And it's just a lot of interesting questions, I thought. So I like that type of thinking, and I like the healthcare environment for that. And really, healthcare insurance is pretty synonymous with healthcare delivery. And so we get to kind of be part of those discussions and help the people who have to make those tougher decisions. And I really like that's why I really like about health insurance, and why I became decided to stay in that field and become a health actuary.
You say that health insurance and health delivery are two sides of the same coin. Could you explain to our listeners just how they're so connected?
Yeah, so I think fundamentally, a person's ability to access healthcare in the U.S. is highly connected to whether they have some type of health insurance coverage. It's difficult to not have any health insurance and to go in and get care. Now, there's the issue of whether you can pay for it. Maybe you can, but even just being able to access providers, you may not be able to access those providers if you don't have insurance. And there's all different forms of insurance. You could have coverage from the government, Medicaid and Medicare, or you could have commercial insurance. But really, if you're not connected to the insurance system, it's hard to access and to pay for the actual health care from providers. So that's what I mean by just saying they
Mhm.
kind of do go hand in hand.
Sure. Obviously, it's wonderful that you find your job interesting, but I wonder whether you could tell us a little bit about how fulfilling you find your role.
So I think I guess this won't be a surprise, since I loved the exam process. When I got to the end of taking the exams, I was a little disappointed. I felt a little unfulfilled, sort of like, well, what now? I've been taking tests for 4 years. And before that, I was in school. And, you're just used to the system of like, you have something you're working towards, you achieve it, it feels good, or you fail, you feel miserable, you try again, and it feels really good, and sort of this process. And so I think I got a lot of fulfillment from the process of taking the exams. When I was done and I felt a little lost and sad. And I thought, oh, now I just go to work every day. This doesn't seem like this isn't what I signed up for. I was very fortunate that I reached out to my employer and said, hey, I don't like this very much. What do you think about me going back to school for another year and studying something, health economics, which I feel is relevant and would help us, and it would help me because I'll feel engaged again, and you'll get the benefit of me learning this. And why I really wanted to study health economics was the I feel like actuaries and health actuaries, we're really good at looking at the data. We really know who had a claim and how much it cost and how frequent, this service is used and all of that stuff. But I feel like when it came to the utilization or that induced utilization, kind of why, like who's going to choose to use a service or who's going to go, I don't think we really knew much about that. And I felt like maybe economics could help kind of fill in that side so we can look at not just the costs and the claims we have, but maybe the behavior like around that utilization and claims data. So my employer agreed that this was a good idea, mutually beneficial for both of us. I worked very part time, about 10 hours a week for my employer, and the rest of my time in my classes. I actually moved down to Baltimore. I went to Johns Hopkins School of Public Health for this program that they offered. It was the first year they were having it. It was a 1 year program. Excellent. It was like about 13 students, wide variety of backgrounds. Some were just right out of undergraduate, but some were medical doctors. There was a pharmacist, me, an actuary. So it was a really diverse group. And we talked more kind of about that healthcare rationing that I mentioned before and just those kinds of topics. And I learned a lot about thinking about how people make choices and the economics, not just the health insurance piece, but it's broader than that, because how people decide to spend their money, do they want to self-insure and, take that risk on themselves, or do they want to buy an insurance product? Just kind of thinking all those, what I feel like is the framework where health insurance sits. I thought that was a really great experience. So I did that. It was a great program. I learned a lot, came back, but so same situation. Now, okay, I learned again, but I still kind of was feeling like, well, this isn't exactly what I want. So I ended up leaving my company, which was a great place, but I just felt, my job doesn't feel as fulfilling. I moved to a small insurance company, and I liked that for a while. I did a little bit more on the health economic side, doing trend analysis, things like that. And I thought that was good, but not quite fulfilled yet. I still hadn't found that place that just felt like my niche. So then I moved again, changed jobs. I went to a small consulting firm where we primarily work for state regulators. And I think this now, like in retrospect, looking back, this is the perfect fit because it's really that blend of the policy side. Like I said, I don't think actuaries, we're not making those decisions, but I like thinking about it. And I like being able to say, what should we do? Should we cover this benefit or that benefit? And what's the value of it? And, how do we assess need and how do we assess value? So I feel like in my current role now, it's that perfect blend of it is very fulfilling because I think the questions that I'm trying to help people answer are important to me, and that that keeps me engaged, and that makes me want to figure out the answers as well and give information. And they're not simple questions. It's not just a yes or no or right or wrong. It's a wide spectrum of things. So I think that what I like most about being an actuary is being able to think about complex problems and not necessarily have to answer them, but help to analyze them and put them into words people can understand. I think that's the best part.
That makes a lot of sense. And your love of lifelong learning, or your apparent love of lifelong learning, clearly stands you in good stead. But of course, that wasn't enough for you. You then decided you wanted to become a volunteer for the academy, right?
That's right.
um, I, I know you play a prominent role at the moment in the Health Equity Committee. But do you want to say a few words about what brought you on to become an academy volunteer, or a volunteer in the first place, and then discuss that particular role?
Yeah, so actually the answer is kind of one and the same because I hadn't really thought about volunteering until I felt this motivation to join the Health Equity Committee. At the time, it was a Health Equity Work Group. But essentially, I was, going about living my life and feeling like, hey, I feel like I have something to contribute to this discussion about health equity that was kind of growing all around us and just equity in general and talking about differences and disparity and all these things that I was seeing in the news and just feeling like, hey, I could be part of this conversation, but where would I put my voice? I like social media. I mean, I think you get lost in a sea of a thousand other voices. And so I was thrilled when I saw that the Academy had a group working on this. I thought, oh, this makes perfect sense. This is my profession, the thing I'm good at. They're working on a topic that I'm interested in. Like it just had never clicked to me before that this would be like a good idea. So I reached out to Annette James, who's the chair, and I said, I'm really interested personally in this topic. Can I get involved? And she said yes. So that was kind of what got me interested in volunteering. Was really having an interest in the subject that they were doing more so than just volunteering in general.
Hmm. Great. Um, and tell us a little bit about the work that the Health Equity Committee is now doing, because you've just come out of I believe, a very successful symposium last fall.
Yes, thank you. I think the symposium was excellent. We so last year we focused a lot on employer benefits and how they can be used to improve equity. And this year we decided to kind of change our focus or our like the main thing that we're going to think about this year to behavioral health. And the reason for that is just such a big topic that again we're seeing in the environment all around us, and we want to be able to respond and to talk about that. Um, so our focus this year is to kind of learn about what are the health equity issues in behavioral health. And it's interesting, one person we talked to said, if you're talking about behavioral health, you are talking about health equity because there are so many issues that people who need behavioral health services face that like they're almost automatically at a disadvantage. So I thought that was really interesting and kind of reaffirmed that we want to focus on this topic. And then we're also focusing on education and communication. So, one of the goals that we have as the Health Equity Committee is to make sure we educate actuaries and other stakeholders, because we talk to a lot of people who aren't actuaries. We want to help them understand health equity issues and, maybe what we can do to help or to either mitigate the issue that exists or to prevent it if possible by being aware of these things. So, education and communication are our other focus for this year. We're doing a few different presentations and publish issue briefs, things like that, to help kind of spread the word and share what we learn as we go through this journey.
Sure. And if I could return to the symposium for a few minutes, because you had a series of discussions in the lead up to it. So it wasn't as if it was a one off event. And through those discussions, you learned, absorbed a lot of information, which you prepared into various issue briefs. And but what are the next steps from the findings of the symposium? Do you feel that there is another outlet for the information that was gathered during that whole process?
I think we learned a lot and we want to kind of share that information in different venues. So we have the issue briefs, as you said. We also have the symposium available. People can rewatch it or watch it if they hadn't seen it. I think we're going to use the information we learned for some of the presentations we do this year. We'll be presenting at the Society of Actuaries, and we'll use some of this discussion about cost versus cost effectiveness. That was a big focus of the symposium. We're going to take that, kind of keep spreading the word and making sure the message gets out there. And also, one of the things that we learned in the symposium, I guess, sort of that overlap, like what role do actuaries play in this whole conversation? Well, one thing we do is we value what benefits are worth. So we kind of look at what's the cost of this benefit, what is the benefit of the benefit, what's the benefit that you get, and how do we think about that? Do we just think about the direct cost and the direct benefits? Do we think about it over a longer time horizon? A lot of things in health insurance, it's 1 year. You're looking at, this year's premiums, this year's claims, and you don't really necessarily account for future benefits. But if they're there and we're not accounting for them, is that really kind of giving you the full value of the benefit? And some of those benefits that you would need to reduce healthcare disparity, they may have a longer term impact. I mean, you might need to spend money today and see benefits down the road. So that was a topic that came out of the symposium and something that we're going to continue to work on as we start to focus on behavioral health. We want to think about, okay, how do we think about what the benefit of behavioral health services are worth? And if they can improve your physical health, how do we account for that? How do we make sure that everything's kind of taken into account when you're looking at it, so you're not kind of skewing the value of some of these things and making the right decision about whether you should or shouldn't cover it?
Let me take a moment to remind listeners that you're listening to Actuary Voices, the podcast from the American Academy of Actuaries. On this podcast, we talk to Academy volunteers and leaders, as well as friends of the Academy, about what inspires them about their work, either professionally or as an Academy volunteer. Please subscribe to Actuary Voices on your preferred podcast platform. And now, back to my conversation with Becky Sheppard, co-chairperson of the Health Equity Committee, which organised a very successful symposium, details of which are at actuary.org/symposium-health-2023. So tell me a little bit more about behavioural health and how you understand it. And is it something that's more difficult to adjust than, say, service provision or plan benefits?
Yeah, so for behavioral health, we're really looking at it's this name that we've given to mental health and to substance use and abuse. So it's a thing, sort of your non-physical health, but you're more related to your mind, I guess. And I think those are more complicated to understand and more difficult to treat. And so insurance products have generally shied away and said, well, we don't know if this treatment's effective, or we don't even have a good measurement. You can measure if someone has diabetes by lab results or things like that. But to measure if someone has depression, you have to rely on a clinician to assess it. And so it's more difficult, I think, to try to get those hard statistics that an insurance company would like to have to be able to put those those stories together. So I think that is one of the major challenges between looking at behavioral health versus physical health. And it makes sense that you'd have more healthcare disparity issues with a product, or with benefits that are harder to evaluate just with cold hard facts. You need to have more subjectivity in looking at those.
Sure. You talked about sort of groups that are more have more health challenges than others, and it would be remiss of me not to note that we're talking in National Minority Health Month, and I imagine that a good focus of the Health Equity Committee is looking at various minorities and underserved communities. Would you like to say a little bit about how you feel that your work might impact those groups?
Yeah, so we definitely think about any group that's I think this is one of the hardest parts because, we want to think, I think every single person should have access to healthcare and should be able to get the things that they need. But what we see from, various studies and published results of things is that that's not what's happening. And there are groups that are at disadvantages for a wide variety of reasons. It's not that just health insurance is driving it, but for whatever reason, the culmination of all those things come together. And the result is that a person who is black or brown is more likely to die in childbirth than I am. And it doesn't make any sense to me. And I don't feel like that's a type of thing that we should ignore. And that's what the Health Equity Committee is really saying. Hey, we didn't necessarily, it's not health insurance that's driving it per se, but we see that these outcomes are not the same across the board. And what can we do to help, or what changes can we make that would address this? So looking at groups that are disadvantaged, either again for any reason, not just a health insurance reason, but saying how can we address that. One of the things that comes up a lot is someone may have a health insurance benefit. So you may say, okay, you have health insurance, and yes, you could go see your primary care doctor for zero cost physical, but they actually can't go because they can't get off from work, or they don't have transportation to get to it, or they don't have a provider that speaks their language and literally they can't understand. And even if they do speak the same language, medical jargon can be so hard to understand, even if you're speaking in the same language, but if you don't really understand what those terms mean. So there are a lot of factors that kind of prevent care from happening, that healthcare from happening. And I think that's, really what the Health Equity Committee is focused on. And to me, it comes down to empathy and understanding that everybody has different experiences, and we don't necessarily need to figure out the why of all of it, but are there things we can do to help address it and to help make things better and at the end in the outcomes.
Those are big problems, and good intentions go a long way in solving those problems. But it's the implementation that I think is often the a barrier, for want of a better word, whether it's a high one or a low one. Have you seen changes in the implementation, either as a result of your work or more generally as a result of maybe changes in society?
I think, yeah, more generally, we see, especially, there's all different payers for health insurance. So you think about the government through their programs of Medicaid and Medicare, or you think about employers. Employers sort of have this a more broad perspective because they think about their employees' health, not just how much does it cost, but also how productive will their employees be. So they have an incentive to help keep people healthy. And so I think we see employers who are implementing initiatives to try to address some of these issues, and we see the government taking action in some ways. If one example is when the government calculates risk adjustment, they're starting to account for other social determinants of health, not just your claims data. So saying, okay, if a person is lower income, or they have less education, or live in an area that is doesn't have enough resources, there's all these other factors that impact a person's health, and they're starting to account for that. So I think being aware and just acknowledging that these things are happening is good, and then implementing benefits that can help. One I often come back to the differences in maternal outcomes, because to me it seems like we should solve that. Like I don't know why that exists. Like let's tackle that one. So one thing Medicaid has started doing is covering doula services, and doulas are just support for a pregnant person. And you don't think of it as like, well, that's a disparity issue. Somebody who can afford to pay for that out of pocket, then they get it, and somebody who can't doesn't get it. But those doula services have a big impact on the outcomes. So it really does matter. It really does impact health outcomes. It's not just someone spending their money to buy a bigger TV and someone gets a smaller TV. Sort of like, okay, yeah, that doesn't really matter, but this matters. This determines if a person will be well, or if they'll be able to, in some cases, survive. So I think it is a big deal. And then, yeah, employers, I think, are taking action. I don't know if our work has led to any specific initiatives, but I do know that we've talked to a lot of different stakeholders, and I just can't get over how happy they are that actuaries are talking about this and that actuaries are working on this, because we really can help tell that value story. Or not that maybe it will cost more money to help reduce disparity. I'm not saying it's always like a dollar saved, but it's just that we can help kind of take the word problem and turn it into math and help them to bring the story forward because they understand like the day-to-day impacts and they understand what people are experiencing, but we can help them with the math around it. And so they're really happy to have us at the table and engage with us about how we can help them to push their work forward. Especially I'm thinking like consumer advocates who are working on very specific issues or groups of people they're trying to help.
Sure. And actually clearly play a very important role. But just from listening to what you said, there are so many touch points and so many variables in the provision of healthcare. It must make you pull your hair out in frustration that there are so many things that could be changed, and perhaps some of them should be changed. But it does seem like a very big problem to solve.
Yeah, I mean, it's very easy to get overwhelmed by it. It feels like sort of we're drowning in the ocean of things. But I do take solace in if we can make one change, if we can help, if one employer implements a new benefit and that helps their employees, you feel like you got to just carry it forward. We actually talked with someone who had worked at CMS previously, and they said, if I can move CMS like 1 degree, then I've impacted, millions of lives by doing that. So I try to keep that in mind. Um, and I think that there's a lot of inertia to it. So if you start talking about it and people start thinking about ideas and it kind of generates new ideas, or in a lot of cases, it's more about removing barriers than creating new things. So those might be easier to do. So I do think it'll probably be it'll take a long time to solve the problem. But if we can make it a little better and a little better and a little better, we'll look back in a year and say, okay, like we've done something, something's happening here. We're moving the needle.
Sure. I'm reminded of an old phrase about education that education is expensive, but lack of education is even more expensive. And it's the same with health coverage. Sure, health coverage it is very expensive, but an absence of health coverage must be infinitely more expensive.
Yep. Yep. I agree.
Becky, we mentioned volunteering briefly earlier, and I would like to ask you a little bit more because obviously you've got a full workload as an actuary and volunteering, including taking part in this podcast, takes a chunk out of your day or your week. And I'm wondering, a, what you find most valuable about it, and B, for your employer, what do they feel about how their employees, uh, how seriously they take the volunteering activities?
So I'm just going to give a little story here. The When I was at Johns Hopkins University, I heard a professor talking about a study they had done, and they said, we know that if we give people mosquito nets, we can help reduce the rates of malaria in this certain geography. So we did that. We gave them mosquito nets, and we expected to see this reduction in malaria, and we didn't. And we were like, oh, that's strange. So they went back and they thought about it, and they decided to charge like a nominal fee for the mosquito net. So, like maybe for us, $10 or something. They say, so you have to buy your mosquito net now. So they sold the mosquito nets at a nominal fee. People were able to purchase them. They found, oh, there was a reduction in malaria from that. And so what they learned is people sort of need to be invested. You need to feel like you're part of it. And to me, that's what volunteering is. I feel like once I started volunteering for the academy, I felt much more engaged and invested in my profession than I had before. So to me, it's sort of this makes it takes time, but I feel I care more and I get more benefit from it. And I feel more that I'm part of the group. I've also met a lot of great people from volunteering. And that's probably the number one benefit of volunteering for me is making those connections. And I think that my employer finds it very important, volunteering very important, and encourages it for the same reasons of building connections and for being invested because our profession is what we make it. And, you know, we regulate ourselves and we have our education standards and all these different things. And we want to keep doing that. So I think I'm proud to be an actuary and I want to continue to be proud. So I want to continue to strengthen and be part of the profession in an engaged way, not just a bystander who kind of hears about things.
I imagine that as another benefit for your employer is that when you are out and about learning from other people and having different kinds of discussions, you're bringing back information to your employer and experiences that maybe nobody in your company might have thought of before.
Yeah, I think that's true. We get a wider range of experiences and perspectives, and also when you're working as a volunteer, people are really bringing their own, um, their own lived experiences and the things they've gone through. And so I feel like you gain a lot. Someone might have went through something. I don't have to go through that experience. I can just hear about it, learn the takeaway, and take that with me. So yeah, I think it's like a jumping point from from their experience.
Sure. Great. Well, I, on behalf of the Academy, want to thank you very much for all your volunteering activity. And we certainly wish that it continues long into the future, because it's our volunteers that make the world make the work of the Academy real, and it amplifies the influence that actuaries have. So thank you. Um, I'm going to put you on the spot a little bit now, because I'm going to ask you about what challenges you think the profession faces in the medium and short and medium term futures.
So, probably like a lot of professions, I think just staying relevant and staying engaged. It seems like we've got this information technology, like a tsunami of chat GPT and all these things coming at us. And how are we still valuable? Can we not be replaced by the computer, or can we? And I think we've made the point we can't, but I think we need to keep making that point and showing what value we add by being not just number crunchers or not just excellent mathematicians, but being able to tell the stories and to talk about things. And I think staying engaged. I wish more people did volunteer and become engaged with the academy or any actuarial organization, so that we stay relevant and that we have a diverse group and we take on new thoughts. Like, the world is changing all around us, and so we just can't keep doing the thing we've done for 100 years. We have to think about whether it makes sense, but at the same time not losing those important principles that we have. So I think being able to be adaptable and be flexible so that we can change with the times but not lose the things that really are the crux of our profession, which I think is unique. And I think we have a skill set that others don't have. And I don't think Chat GPT can do it for us. So let's make sure everyone knows that.
Yeah, I think you're right. It's people often say that the actuarial profession is definitely a niche profession, and far more people ask, "What does an actuary do?" than knows what an actuary does, and that generalization of knowledge about what an actuary does is a vital role that actuaries play. Even though every dinner party you're asked, "Oh, so what is it you do?" Even if it's
Yeah.
back to your early points, you're going to tell me when I'm going to die.
Yeah.
um, Finally, I guess, Becky, I wonder if you have time for it. Can you tell me what you do for fun?
Well, if you can believe it, I love to crochet. And I like to
Mm.
crochet completely useless things like stuffed animals or dolls or toys, not practical things like sweaters or scarves or things you might need or want. No, no. So, I mean, there's probably other actuaries who do that, but I think that's one unique thing I like to do. And I also have 3 young children, so it feels like I don't have a lot of free time.
I can imagine. In fact, the Academy president Lisa Slotsnik, she also crochets quite a
Oh,
bit. So
excellent.
you can bond over that the next time you meet her.
Wonderful.
Is there anything that we didn't cover that you'd like to touch on before we close out?
I think the only thing I'd like to say is just, a word of encouragement for anyone who's thinking about volunteering for the academy. It's well worth it. Yes, it does take some time, but I've been a volunteer for a few years, and I think the value that I've gotten, it makes me excited about my job. It makes me excited about my profession. It feels like my voice is heard. Those benefits have been phenomenal. So if you're kind of hesitant or not sure or feel like you don't have anything to offer, you definitely do. And there are great volunteer leaders who will get you right in the door and make you feel like you're part of the team right away. So just a word of encouragement.
Becky, thank you so much for your time today. We really appreciate it.
Thank you. It's been fun.
Today, I was speaking with Becky Sheppard, co-chairperson of the Health Equity Committee, which organised a very successful health symposium, details of which are at actuary.org/symposium-health-2023. My name is David Nolan, and I'm the host of Actuary Voices, the podcast from the American Academy of Actuaries. Please visit our website, actuary.org, for a wealth of information about the work that the Academy does. You can also follow us on Facebook, Twitter, and LinkedIn. And of course, please subscribe to this podcast on your preferred podcast platform.